So many of you may have seen an audiogram. An audiogram is just an audiologist's way to chart how the brain is perceiving sound. Okay, so back in the video we talked about how the cochlea is organized tonotopically. That the base of the cochlea, the part that is closest to those little middle ear bones, picks up the highest pitches, and that all the way curled inside that snail shell at the very inside of it is where the lowest pitch sounds are picked up by the hair cells. So kids don't just have all or nothing hearing. They often have typical hearing in some pitches and difficulty hearing in other pitches. And the audiogram is the way to graphically depict what a child can and cannot hear. Okay, so oftentimes when people lose their hearing because they get older, they will have perfect hearing in the really low pitches, but the high pitches will be impacted. And of course, when you think about how that cochlea is organized, the most susceptible hair cells are the ones that are closest to the middle ear system, and those are the high-pitched sounds. So that makes sense, right? So the audiogram is organized from low pitch on the left to high pitch on the right, very soft sounds on the bottom and very loud sounds on the top. So when an audiologist does the kind of test where you hear the beep sounds and you have to raise your hand and the beeps get quieter and quieter and quieter, audiologists will graph on this chart the softest sound you can hear at each pitch. And then that will help us to describe that hearing loss. So sometimes you'll hear a hearing loss described as a mild sloping to severe hearing loss. That means in the low pitches, they can hear pretty normally, and in the high pitches, they don't hear very much at all. Okay, sometimes we use something like this audiogram of familiar sounds to help families understand why their child might be hearing the father's truck coming up the driveway, but not able to hear the doorbell ringing, or why they might be talking in a way that doesn't represent some of the speech sounds, especially the higher pitched speech sounds like S's and K's and TH's and F's. Those sounds are often very hard to hear because they're higher pitch and softer sounds. So this is just a graph of where these sounds typically occur. The pink line is called the speech banana. So again, kids with hearing loss can learn to speak and talk. They might have some articulation issues because they're not hearing certain sounds. When we put amplification on a child, like hearing aids or a cochlear implant, what we're doing is we're boosting the intensity of the sounds at the different pitches. Okay, so we're helping to make the soft sounds that are soft because of the hearing loss louder. What that does not mean is that we're making those sounds clearer. And so I just want to make that really important distinction, because sometimes we can make the sounds louder, but depending on how the child's brain perceives those sounds, they might still have some unclear speech. So when a child has an identified hearing loss, and we talk about the degree and configuration of the hearing loss, it will often say something like the child has either a unilateral or a bilateral hearing loss. So that means the hearing loss is in either one or both ears. And then we'll describe that it's either a conductive or a sensory neural or a mixed loss. And that references where in that auditory system the hearing loss is actually occurring. Again, conductive hearing loss, outer and middle ear, sensory neural hearing loss, inner ear and beyond. Okay, so we'll have a bilateral sensory neural hearing loss. And then when we talk about moderate or mild hearing loss, that's actually describing what pitches and loudness the child can hear.